everyone, I am Kyla Christine Dela Cruz from BSN1C, and today I will be performing a return demonstration regarding vital sign taking. The accurate measurement of vital sign is critical because it reflects body basic functioning. It serves as the baseline data which allow us to track changes in the patient condition and recognizes every patient deterioration as well as harm or hazard that may occur. The vital signs include temperature, pulse rate, respiration rate, and blood pressure. And we always remember to perform hand hygiene before and after the procedure to avoid contamination. Prior to the conduct of the procedure, I will be going to close the door and the curtains to ensure my patient privacy. And I will adjust the room temperature for my patient comfort. Now, I am going to obtain for the patient body temperature. When we see temperature, it is different in heat produced and heat lost of the patient body, and it is measured by using a thermometer. Prior to the procedure, we're going to introduce myself and explain the procedure to the patient. Good morning, ma'am. I'm Nurse Carla, and you are?
I am Kay Nogues.
So today, I will be assessing your vital sign. But before that, as you're going to check for the patient body temperature, there are three methods that we use. The first one is the oral method. The second one is auxiliary method, and the third one is rectal method. But we're going to do now, I am going to obtain now the patient body temperature by using auxiliary methods. As we are going to start obtaining the patient body temperature, we must first sanitize our hand using an alcohol. First is the auxiliary route. Before using the thermometer, clean it first using a cotton ball with water and firm twisting motion to the valve to the throw the cotton ball waste and the trash can and dry it using a clean tissue and throw it to the trash can. Turn it on and next raise the client arms and insert the axilla and lower arm properly across chest. And leave the thermometer for a minute until you hear a beeping sound. And then, while waiting, I will get radial pulse of the patient. Because I already hear the beeping sound of the thermometer, I remove it and read the temperature. Disinfect the thermometer using an alcohol swab from stem to bulb and turn it off and put it back to his container for the next use. Document the findings. Let's now obtain the first vital sign, which is the temperature, by using the auxiliary methods. Since we are done with the first vital sign, which is the temperature, I am going to proceed on a second vital sign and a third vital sign, which is pulse rate and respiratory rate. When we say pulse rate, it is arithmetically throbbing that results from wave both blood as the heart contact, while when we say respiration, it is the exchange of oxygen and carbon dioxide at the atmosphere, and it is initiated as the act of breathing. And the second vital sign is assessing radial pulse. So first, position the client arm along the side of the body. Then place your first, second, and third finger over the artery. Using the watch, count the number of palpitations you felt for 30 seconds and multiply it by 2. If the rhythm amplitude of the patient is abnormal, palpate and count the pulse rate for 1 minute. And lastly, don't forget to document the findings. The third vital sign is monitoring respiratory rate. Keep finger on the client's wrist and place the arm across chest. Using a watch, with a second hand, count the number of respiration for 30 seconds and multiply it by 2 to calculate the respiratory rate of the clients per minute. Then document the findings. Now, let's proceed on obtaining for the patient cardiac rate of the apical pulse by using an instrument called stethoscope. And we are going to position the patient in the supine position. Put the earpiece on the ear and put the diaphragm of stethoscope to the apex of the heart of the patient located in the mid intercostal space of clavicular line. Then, move the diaphragm to the side of the loudest part. Then count the number of the beat for 60 seconds. And document the findings. As we are done for the first, second, and third vital sign, we're going to proceed for the fourth vital sign, which is the blood pressure. To say blood pressure, it is a lateral force exerted by the blood on the arterial walls. The last vital sign is blood pressure. Patient a comfortable position with the forearm supported at level of heart and palm of hand upward. Rough the cuff around the arm smoothly. Place the stethoscope earpiece on ears and palpate the brachial artery. Place the bell of the stethoscope firmly with little pressure as possible. Next, pump hand valve to 80 mmHg above last pulse left, and then open the valve on manometer and allow air to escape slowly. Note: pressure at where it first regular sound and points of muttling in which sound disappear. Remove the earpiece from the ear and cuff from the patient's arm. Document the findings so that we obtain the blood pressure of the patient. The overall finding is so that's it. Once again, I am Kyla Christine de la Cruz, a student nurse of North Valley College, and I hope that you learned something with this video. Thank you for watching. Goodbye!